Anterior surgical approaches, ilioinguinal approach, indication anterior fracture of acetabulum, iliac fossa, sacroiliac joint, and pubic diastasis. Superficial interval is between external oblique and inguinal ligament. Deep interval is between internal oblique segmental. Structures are LISC and lateral femoral cutaneous nerve of the thigh, spermatic cord, inferior epigastric artery, as well as external iliac vessels. 3 windows are created. Lateral window is lateral to iliopsoas muscle. Middle window is between iliopectineal fascia and iliopsoas plus and external iliac vessels. Third window is between the vessels and spermatic cord. Stopper approach is basically an extensive medial approach and provide access to the pelvic brim and quadrilateral space. So it avoids the dissection through the ilioinguinal ligament. Cocker-Langenbeck approach. It is approach through the posterior wall, posterior column, and simple transverse fractures. Superficial interval divide the gluteus maximus, which is supplied by inferior gluteal nerve and iliotibial band. The deep interval is from piriformis, nerve to piriformis, and gluteus medius. The piriformis is supplied by the nerve to piriformis and gluteus medius by superior gluteal nerve. Risks are sciatic nerve, superior and inferior nerve and artery, and medial femoral circumflex artery. Regarding anterior approach, Smith-Peterson approach, open reduction GDH, neck fractures, for reduction, synovial biopsies, intra-articular fusion, total hip replacement also possible, hemi-excision of tumors, especially of the pelvis. Incision line. Mark the ASIS and the incision 1 inch lateral and 1 inch distal to the ASIS, anterior to the greater trochanter. Proceed towards the lateral border of the patella. Superficial interval is sartorius and tensor fascia lata. Deep interval is rectus femoris and gluteus medius. Remember, sartorius is supplied by femoral nerve, and rectus femoris is also supplied by femoral nerve. Gluteus medius is supplied by superior gluteal nerve, and tensor fascia lata is supplied by superior gluteal nerve as well. Structure at risk: lateral femoral cutaneous nerve, femoral nerve and artery, superficial iliac circumflex artery, lateral femoral circumflex artery. Disadvantages: femur exposure is difficult and it can have risk of fracture. Anterolateral Watson-Jones approach can be done for total hip replacement ORIF of the neck of femur. Incision is centered on greater trochanter. Superficial interval is between the tensor fascia lata and gluteus medius. Deep interval is between the split gluteus medius. Structure at risk: femoral nerve, artery, superficial gluteal nerve, and lateral circumflex femoral artery, descending branch. Advantage is stability. Harding approach is between the gluteus medius and you divide gluteus medius and divide vastus lateralis. Superficial dissection is by splitting iliotibial band. Structure at risk is superficial gluteal nerve and lateral femoral circumflex artery.